here. I guess we're recording. This recording will be made available if anyone misses this by chance, or you want to forward it to someone else. What this is our first meeting for this year for the Mental Health Services Act in our community planning process. This is a requirement that we have every year to update our current plan. We're currently in a 3-year plan that extends from fiscal year 2020 through 2023. And so this is actually our second update, preparing for fiscal year 22-23, which is the last of this plan. We have utilized RDA to assist with this process. They're our consultants. They've helped us every year in this process, and they will be doing a good portion of this presentation today. But before I turn it back over to them, the first thing I'd like to do is I'd like to thank you for being here. I know your time is valuable, and so it's very appreciated that you're here. Your input in this process is extremely important. The Mental Health Services Act is all based on community input and stakeholder feedback. Although funds come to behavioral health, it's actually the planning is done with the community for these funds. So it's very important. So thank you so much for being here. I'm going to turn it back over to Aditi to get this going.
Great, thank you so much, Scott. And like Scott said, we're very, very grateful for everyone to be here today. Thank you so much for coming. We're looking forward to engaging with you. So before I move on, as you can see up here, it would be really wonderful if folks could take a moment, especially those who are at the centers, to fill out the sign-in sheet as well as the demographic form. Your center facilitators should have those materials with them. And for those of us joining the call virtually, it would be great if you'd like to enter your name into the chat box as well as fill out the demographic survey. My colleague has been dropping it into the link and will continue to do so for a little longer. You could also take a snapshot of the QR code on this screen. So we really urge you all, as we'd like to capture this demographic information. Thank you. Great. So as you know, this is Lake County's MHSA community planning meeting. This is the first of 2 meetings that we're hosting, and this is for the financial year 22-23. And this is really the annual update process. And again, want to go back to the welcome and introductions piece, just to take a moment to show off.
No, we have to have it on.
Hello. Oh, there we go. Hi there. So again, just to reiterate, if you're attending in person, please do take a moment to fill out the sign-in sheet. If you're online, feel free to use the Zoom chat function to introduce yourselves. These are the prompts. You could use your name, pronoun, as well as the program if you are a part of a program. We definitely want to welcome and have folks introduce themselves. So feel free to just add your details into the Zoom chat. Oh, okay. Oops. Did you hear anything? I don't know. Was I completely unmuted? I don't know what happened. All right.
I just want to say, just kind of mention the nature of this meeting real quick. This meeting is both being done on Zoom, as probably most of you are attending, and we're also having it as a hybrid meeting within our peer support centers around the lake, and they're also connected to this meeting via Zoom.
Great, thanks so much, Scott. Yes, this is definitely a hybrid meeting, so where we want to invite participation from both folks in person as well as online. And I'll also talk about just a few slides down the road, ways of how everyone can contribute to the discussion and conversation so that it makes it as seamless as possible. Wonderful. So in our next slide, I'd like to talk about just really the broad agenda for what are the different areas we're going to be talking about today, and really the key objectives for today's meeting. So to begin with, the first half of this meeting is going to sort of be an educational piece, which is focused on providing more of an overview and background about the Mental Health Services Act. In addition, as Scott mentioned, we will also briefly talk about what the annual update and community planning process entails. Then we're going to get into sort of a status update from the specific LCBHS, MHSA programs, as well as the modifications that have happened since the last time folks gathered this forum, which was last year. And then finally, we're going to end with a breakout discussion session, which is very much focused on needs assessment as well as assessing gaps in services. So related to the agenda, we have our two major objectives here. As you could see, the first one is very much to provide an opportunity to present an update of all of the MHSA programs at Lake County, as well as provide more of a context and background to meet the needs assessment piece. And as Scott mentioned in the beginning, this is very much an opportunity for everyone to weigh in and bring their perspectives and lived experiences to bear, because this is very much seen as a community collaboration effort. So we would really urge everyone to feel free to participate. Like I said, I'm going to talk about some meeting tips in my next slide, as well as provide ways in which you could contribute to the discussion. Since this is a hybrid model, there are just a few meeting tips that I'd like to highlight. So this is, for those attending in person, as you all know, there is a coordinator who has been assigned per site. They're going to help manage the Zoom meeting, as they're already doing, and thank you so much for that, as well as facilitate the attendee participation. If you're joining virtually, and this is, of course, if possible, it would be great if you could go to a quiet, distraction-free location, ideally with either strong internet or those who are dialing in with a strong phone connection, because Zoom can sort of be tricky. Please, we urge you to save any substantive comments, questions, or feedback. We will take an opportunity and moment to review them, and we're definitely collecting them as they come in. If there are some clarifying questions during the presentation, definitely choose the Zoom function if you're joining virtually by raising your hand or entering the question in the chat. And similarly, for those who are on site, you could let your coordinator know. The coordinator can then unmute themselves and bring the clarifying question forward, or alternatively enter the question into the chat. So these are these are just some tips I wanted to talk about. And then, as you could see, these are the sort of 4 different ways of how folks can contribute to the discussion within the computer screen. And hopefully, folks are reasonably familiar with Zoom. But basically, you need to go and scroll to the bottom of your screen on Zoom, and you should see a participant icon, which allows you to raise your hand. My colleagues and folks at LCBHS will be looking out for anyone who has questions, so feel free to raise your hand. Similarly, for those who are dialing in to speak over the phone, you need to sort of raise your hand by pressing the *9 option on your phone. The chat function, as I just mentioned, Zoom has a chat feature, so we definitely want to be able to engage and have these conversations with all of you through the Zoom chat. And similarly, the meeting facilitators at the centers can also do the same. And then finally, we also have Scott's email address up here. So if there are any questions, either during the process or post the meeting, feel free to reach out to us, and you can directly email Scott right here.
And I just want to emphasize one more time, if you could please fill out the demographic survey, which is in the chat. The link's in the chat. It's one of the requirements we have for this meeting. We have to report back to DHCS, Department of Health Services, who's attended these meetings. We want to make sure we're really touching the community.
Thank you, Scott. All right, so we're ready to delve in. Here's the first section of the agenda that I talked about, which is the Mental Health Services Act training and education piece. So I'm just going to give everyone a background and context of how the MHSA Act came to be. So this was an act which was championed by consumer, family member, and parent, as well as caregivers of children and youth with mental health issues. And this was through Proposition 63, where the Mental Health Services Act was passed by California residents. Income, it's sort of known as the millionaire's tax, where anyone who makes an income over $1 million is taxed at 1%. And this tax money has basically gone into the MHSA fund to expand and develop multicultural, innovative, integrated services. And these services are really meant to reflect the cultural, ethnic, and racial diversity of consumers and families served. So here on the screen, you can see that there are these 5 buckets that we have up here. They're essentially meant to reflect the values and guiding principles of the MHSA Act. So you have the wellness, recovery, and resilience piece, which is really meant for the mental health consumers. And it's very much sort of enmeshed and grounded on this notion of hope, personal empowerment, respect, social connections, and self-responsibility. Cultural competence is another key piece, which is, MHSA is really meant to be responsive to cultural needs and also have a very clear equity focus. A lot of the services are very much client and family driven, where the client and families are really at the center of this entire process and are seen as the primary decision makers. You have the integrated service experience, where there's a lot of effort put into sort of coordination of care, especially across different agencies and organizations. And then finally, we have the community collaboration piece, which is really this idea, and really one of the reasons why we're here today is to invite community members as well as service providers who are a part of the mental health system to pool in and share their knowledge and their lived experiences in order to fulfill a shared vision and goal. And again, just to reiterate, that's really one of the reasons why we're here today. So more of an MHSA overview. As you can see, these are the different components of the MHSA program. The largest component of the funding goes into the community services and supports, which is CSS, which is makes up about 3/4 of the funding. And it's directed to folks who already have established mental health needs. About half of the CSS funding goes to full service partnership programs. Then comes sort of the next leg of funding, which is the PEI piece. PEI stands for Prevention and Early Intervention. About half of PEI has to go to children and youth services, and it's really focused on intervening when there are early warning signs. And with PEI programs, there's typically a lot more flexibility with what the programs can do. And then we have about 5% of the allocation that goes to the innovation fund. And this really allows counties the opportunities to test something different and be creative and innovative with their approaches. In addition, we have the workforce education and training pieces, which is focused on improving the public mental health workforce. And then we have the capital, facilities, and technology needs, which is you need to have the infrastructure support to support all of the other components listed here.
And so those last 2, workforce education and training and capital, facilities, and technological needs, are funded through the first one, the community services and supports. We can use up to 20% of that particular category to fund the last 2.
Great, thank you so much, Scott. So here, everyone can see this is sort of the list of the programs that we have based on the different components I just talked about in the previous slides. I will not go through this list right now, but we'll sort of keep this up for a few seconds, only to let you know that there is a part of this meeting where we're going to actually have the programs come and report out. And we'll be talking about what all of them have been up to since the last time this group reconvened last year. So these are the different brackets, which is CSS, PEI, INN, CFDN, and WEP. And then for those of you, sorry, go ahead.
Real quick,
Yeah.
Someone from Access Cal Voices was talking about not forgetting the up to 5% for CPP.
Great, thank you so much. Thanks, Nimisha, and thank you so much for bringing that to our attention.
CPP is community planning process.
Okay, thanks, Scott. Great. So for those of you who are interested in learning more about the background and overview, we have provided a link here. My colleague's also going to drop this link in the chat, so feel free to open that link out and read up, and feel free to follow up if you have any clarifying questions. All right, so moving on to our second section, which is focused on the annual update and community planning process. I want to just give everyone an overview of what this looks like, starting off with the purpose and intention. And Scott really summed this up initially, where this annual update it happens on an annual basis, and it's part of the MHSA 3-year program update, which Scott mentioned began in 2020. So this is the last of the 3 annual updates. And the focus is very much meant to provide everyone an opportunity to learn about the program status as well as service accomplishments in the previous year. And then also, based on the needs assessments that we're going to talk about today, and we also have had opportunities. We've launched the community survey and are going to have upcoming focus group conversations to learn about more gaps in services and where there is scope for improvement. And this is why we're having the community planning process.
The elevator turned over to us.
The MHSA process, it's really intended to have a meaningful engagement with stakeholders who are all present here today, such as yourselves, because you're very much seen as the folks who have the subject matter expertise and can really contribute well to the development of plans. So that's really why we're having this annual update process. As you could see, this is the sort of list of MHSA stakeholders, and these are essentially folks who interact with the mental health system here at Lake County. So we have everyone from consumers and family voices down to healthcare organizations and other service providers. And I think that is definitely represented based on folks who are here participating today. I just want to take a minute to talk about some key roles and responsibilities who are part of this annual update and community planning process. We, of course, like I said, we have the stakeholders who are folks who interact with the mental health system. We also have the Behavioral Health Services Department that we have Scott and Patty and Carrie and other folks who are part of that, who are essentially providing services and render services and update programs based on needs. We have the Mental Health Advisory Board. They're really seen as an oversight body that advises on the MHSA process. You have the Board of Supervisors, who would eventually review and approve the annual MHSA update. And then finally, you have us, and really we're here to help facilitate this entire process and really learn from everyone. And then finally, I want to sort of talk about the MHSA planning activities. This is just to give everybody a sense for what this timeline is and what are the different activities involved. So as you can see here, highlighted in yellow, we're kind of in the phase 2, which is the needs assessment phase, where, as I said, we're conducting this community meeting. This is one of 2 meetings. We're going to have another upcoming meeting in April. We have already launched the community survey and would urge folks to definitely participate and provide your perspectives. We're also going to be conducting focus groups moving forward, and we're also collecting and updating the program data from the year that was. Then we're going to move into phase 3, which is the program planning phase, which is us really synthesizing a lot of the stakeholder inputs and identifying potential updates. And then we finally have phase 4, which is the plan.
I just want to add, just within phase 3, in phase 3, we will also be having another stakeholder meeting to kind of report on phase 2 and to get more input about, based on that data, where should we go from here as far as the plan. So that's really important too.
Perfect. Thanks, Scott.
Sorry.
No, not at all. Awesome. So, and then again, let me just reiterate the plan development phase. These are the sort of key elements, which is once we develop the annual update. We're going to have a public posting of the report. We're going to have a public hearing, as well as finalizing and updating the report, which will get presented to the Board of Supervisors. So we just wanted to be transparent about what are the different activities involved so that folks who are part of this meeting have a sense for what that's going to look like. Great. So Scott, this is where I was going to actually launch our quick stakeholder poll. Can I go ahead and do so?
Yes.
Okay. And you can give folks a little update of what this is.
Right. So this is a clever way that Dee thought of how to show evidence that you've been trained. That's one of the things that we've been tasked with by the state, is to show evidence that the training that you just received, you did in fact receive it. So we have a poll that acknowledges that, yes, you've been trained.
Great, thank you so much, Scott. Very important background. So I'm actually going to launch a Zoom poll right now. I would urge everyone to take a few minutes to respond to it. It's fairly straightforward, and as Scott mentioned, this is one of the requirements of MHSA. And let me know if folks are having trouble accessing it. Okay, I'm going to go ahead and launch it. Oh, I see Raven has her hand raised. Go ahead, Raven.
Yes, how would you like the in-person services to do the stakeholder poll as well?
Great question, Raven. So I think if it's possible to ask folks to do sort of like a hand show, like, folks can raise their hands for those who feel that they've been trained. And if someone can make a estimated number of the number of hands that are up, that would be great. I hope that's a good workaround. Okay, great. Thank you so much, Raven. Okay, I'm going to go ahead and launch it. So I hope everyone has the poll open now.
Okay, we're up to 17, 18.
I know, that's great.
19.
Yeah. I'm definitely trying to make sure we're allowing everyone to weigh in. So almost there.
9 more of you there.
I'll give folks maybe another 30 seconds or so. We do want to move on. If folks would like to respond via Zoom chat or even unmute yourselves and provide your response, that is also perfectly acceptable. All right, well, 75% is good. And as I said, feel free to drop it in the chat if you do have a response, because we just want to understand if folks have a reasonably good understanding of what was just presented about the Mental Health Services Act, as well as Lake County's annual update and community planning process for financial year 22-23. So I'm going to actually end the poll now. And thank you all for those who participated. We can take a quick look at the shared results. Well, there we go. So it looks like about 50% agree, which is great, and 32% strongly agree, and we have about 18% who are sort of in the neutral category, and would love to hear from the facilitators at the centers what those numbers might look like. So thank you all. Thanks for participating. Great. So now I'm going to move us along to the next section, and this is really one of the key pieces of today's meeting, as well as the breakout discussion that's going to follow this. And this is about where we have the opportunities to learn and hear from the MHSA programs at Lake County. Scott, I'm going to pass this on to you now.
Okay. So what we'd like to do is we're going to have what you see on the left-hand column right there. That's the listing of the programs that we do have in Lake County under the Mental Health Services Act, which is actually really impressive. I believe, being a small county that we are, we have a lot of different programs which take place, which I'm really grateful for. And I feel it's important that as we talk about, the upcoming plan, is to know where we're at presently, so that when you're thinking of feedback and ideas, you have a foundation to know kind of where we're at, what we already do. And so in order to do that, I'm going to have the programs themselves spend about 2 or 3 minutes, so not much time, but this 2 or 3 minutes just kind of answering these questions, essentially just kind of describing what they do, and things that are working, some challenges that they have, and that's really basically it. And so we'll just go through the order right here. So the first one under community services and supports is the crisis access continuum, and I asked Summer if she could describe that. You there, Summer?
I'm here. Thank you, Scott.
Thanks, Summer.
Summer Trongo. I'm the supervising behavioral health clinician for the crisis team. Let's see. Our biggest successes to the program that we've accomplished is reducing the number of individuals going to the emergency rooms. And we do this by being able to go out into the community with law enforcement, go to the peer support centers. We'll see anybody anywhere. Most of them result in safety planning and community resources versus hospitalization. The biggest challenge, and it's been a challenge, I believe, across the board, is staffing. We were fully staffed for a brief moment. It was very nice. But since now we have 1 team leader, 1 case manager, and 3 crisis workers for 24/7 coverage. So it does make it a little bit difficult, but we make it work. Nothing really new at the moment. We're just here and offering our support, and no modifications or changes have been made as of yet.
Great. Thanks, Summer. This is a really important program. I just want to emphasize and appreciate the work that Summer and her team does. These cover crisis services that don't result in a hospitalization or a 5150 hold. And it's the idea of being able to support clients that are going through a rough time in other ways. Okay. Next, we have the Forensic Mental Health Partnership. And Crystal, are you here? Not sure if Crystal's here or not. Anyone seen me? Hang on. James, are you there?
Yes, I am. I'm sorry.
Is there any way you could fill in for Crystal? And just talk about the Forensic Mental Health Partnership.
Well, I can say that that we have court referrals coming through the referral system very consistently. We're looking at capacity issues again because of staffing. About 2 years ago, the courts were given the legal go ahead to start assigning people who are charged with nonviolent crimes who had a history of mental health conditions with a diversion. So we get a lot of diversion referrals too, and that's become part of our what we call our justice involved team. So that it includes our work in the jail would be more the forensic mental health partnership, and with COVID, that's been a real challenge because they would have to have the staff on the other end to be on video with the inmate for us to do any planning. We do the best we can. We're fairly maxed out. We do follow up when people are released, though. So the MHSA part of Justice Involved team is able to also not let folks fall through the cracks when they're released if they don't have services. So some people don't have formal probation or state AB 109 probation, and they are coming to us if they're homeless and have a mental health condition or need other resources as well. And we assist. You have any questions, Scott? Is there anything I missed?
No, I think I appreciate you filling in there. See, Crystal, this came on. You there, Crystal?
Yeah, I'm here.
Okay, good. You have a lot to report on today. So I got a little nervous there. So James, I think, did a really great job of talking about the forensic program that we have. Next on our list, and you just kind of being thrown in here, we're going through the program reports right now. And we're talking about, the next one is the FSP programs. Could you talk about those in relation to these questions? Introduce yourself and what you do.
I'm Crystal Rodriguez, and I am supervising adults in diversion and probation with Lake County Behavioral Health. So FSP, right now, getting people housed in our low-income apartments has been a huge success. We've gotten several in just this last week and a half, which is also been our biggest challenge in the housing world of FSP.
Right. Let me just kind of interject here real quick. You're getting a little more detailed. I want to kind of just do a brief overview, then you can get to the detailed part.
Okay.
The FSP program is our largest program of MHSA. It has to be over half of as you can see, the community services and supports. Over half has to be FSP. And what FSP was designed for was to help those that are the most vulnerable, the most at risk due to their mental illness, their risk for institutionalization, hospitalization, or homelessness due to their mental illness. And so these are folks that really need our help, and hence why the law has designed the Mental Health Services Act to provide such supports too. One of our biggest challenges, as you can probably imagine, with this population is homelessness. And that's what Crystal was starting to address right there. And I'll turn it back over to you, Crystal, to finish out. Sorry.
No problem. I just think I confused questions and what was being asked. Sorry about that.
You're doing great.
So homelessness is our biggest challenge. And then getting low income, getting them out of hotels or motels. So we've seen changes in that recently, which has really improved, because when they have stability in housing, we're able to focus on getting them stable in their mental health symptoms. So that's kind of where we're at right there for challenges, and just engaging people and kind of, I think, being more, maybe we haven't always been very clear on, what is expected in FSP. So we're really focusing on making sure we really explain that really well when our individuals come into the program. We're really working on our engagement. There's what's new.
Okay.
I guess there's not a lot of things that are new. It's just kind of restructuring a little bit to make sure we're meeting the FSP needs, the FSP goals. to better help our clients be able to meet those goals. So that's what we're working on right now, is really gaining that structure.
Right. It's a difficult population to work with.
It is.
I know you often have challenges of just trying to track people down and meet with them and keep that partnership going. The service itself is all voluntarily. So we're limited about as much as what our clients are willing to partner with.
Or capable of.
Right.
At the times. So definitely taking that into consideration and meeting them where they're at in those capabilities.
Right. And Crystal and her team do an excellent job in this process. It's very challenging work, but they are very dedicated in doing it. Let's move on to older adult access. Crystal's also over our older adult population. Do you have anything that you want to add about that, Crystal?
They seem to be our hardest population to connect with, especially through COVID. So I have case managers that are going to start going to the senior centers again, as many of them have opened up a little bit to connect, to speak with people, because our challenge is being able to meet their needs or really engage with them with that specific population. So trying to really get out there, let them know we're here, meet people in the community.
Right. And one thing I just kind of want to add to that, and this is more talking about in the next major section, prevention and early intervention services, is we are in the process of trying to hire a prevention outreach worker that is specifically designed to work with older adults. This has been expressed quite a bit within these meetings, and we're finally have the ability to be able to do that. So that particular individual will be working out of the senior centers and working with the senior centers to try and do outreach to this population. Another program within here is our senior peer counseling done by Konocti Senior Support. Well, I see you there, Rebecca, but I'm going to have you report later in our prevention area under. Are you reporting for Francois? Oh, got it. Okay. I was looking for Francois, but Rebecca, I'll let you report it. And by the way, it's great seeing you, Rebecca. You're on mute. Still on mute. There you go. Oh, back on it. I think you re-clicked yourself. Rebecca, you're still on mute. There you go.
There we go.
Yes, Francois wasn't able to make it today, but he wanted me to report that we're able to continue our outreach to the from the senior peer counselors to the community. At this point, we have more requests for services than we have volunteers, so we're trying to reach out and get more volunteers. And COVID, of course, has been our biggest difficulty because these are the most vulnerable people to infection. And so that our volunteers are older and our clients are older, it's hard to get people together. Thank you.
Thank you very much, Rebecca. And you'll be reporting later as well.
Yes.
Next is our parent partner, which Carrie, I think, was going to be talking about that.
Good morning, everybody. So our parent partner position is currently vacant. We are looking for prospective candidates. And before the position became vacant, we were doing parent cafes. We were reaching out to the schools. We were trying to promote, the services that are provided through that position. I think the biggest challenge has been staffing, which I think you're going to kind of hear throughout our updates, but and also engaging the community and letting the community know that we're here and what the parent partner can do for parents and for the community. And I guess what we're working on right now is how to promote that service as well as hiring someone for that position. Thanks, Scott.
Okay, thank you. Okay, and Carolina, are you here?
I am here.
Great. Can we ask you to talk about our co-occurring, trauma-informed co-occurring program?
Sure.
What does it mean by trauma-informed? If you could help people understand that.
By trauma-informed, it means that Lake County Behavioral Health is a trauma-informed and co-occurring disorders agency, which means every single of our staff is trained how to identify the needs of our clients related to those issues. So by the moment that the client reach out for services to Lake County Behavioral Health, at the access team, client is assessed and screened for trauma and co-occurring issues disorders. And the referral process to any of the programs that the client fits, we are taking into consideration the client needs about trauma and co-occurring disorders, related needs. So we work on developing a treatment plan to assist that specific client's needs. So the agency has been investing a lot in our staff in trainings to have the staff able to identify those needs and assist drawing a treatment plan that with that perspective. So trainings like trauma-informed and trauma-focused CBT, for example, have been some of the investments that Lake County Behavioral Health has been doing through the years to improve assisting the needs of our clients for the services that they receive. We have had in the past some successes with groups that were offered with that focus of trauma and co-occurring disorders focus. But with the challenges of the pandemics, we have not been so successful with groups anymore. But we do take into consideration in the range of ages and teams that we have, considering specific needs of each client related to whatever issues with trauma or co-occurring disorders issues that they may bring. So
great, thank you. Caroline is one of our team leaders, and she does a lot of work with our co-occurring clients. Does a lot of excellent work. Her team. This is a difficult population, as you can probably imagine, and Caroline has really dedicated herself to seeing that through for them.
Thank you, Scott.
Next we have our next biggest section is prevention and early intervention, with a number of different programs funded underneath that. One of the requirements that we have for that prevention and early intervention is that over 50%, over half of the services that we do have to be for, or either directly or indirectly, children and youth. So that's an important regulation that we always have to keep in mind as we're planning prevention early intervention strategies. The first program within that is our early intervention services, and is Elizabeth Bevan here? I think she's here.
I am.
Great,
here.
awesome. Okay, can you talk about that?
Of
and
course.
what you do and why you're talking about it?
I will introduce myself and say what we do and answer your questions.
Great.
So I am Elizabeth Bevan. I'm a licensed marriage and family therapist, and I'm the supervisor for the Early Intervention Services team. The Early Intervention Services team has been with the county for a while. What we do is we work with youth who are at clinical high risk for developing psychosis. So that means they're showing warning signs that psychosis could develop, or people who have had like their first full psychotic episode within like the last 2 years. So we're really trying to intervene early on in the illness before it really progresses, because that leads to better life outcomes. So we're in an interesting place because we recently received a grant through the state of California called EpiCal Plus, and it is part of a California statewide initiative to implement early psychosis intervention programs throughout the state of California. So we've been working a lot with them to restructure our program. So let me go into kind of our biggest successes. So some of our accomplishments have been, so we have initiated like a more formalized EIS assessment process, which really helps us accurately assess our clients for the program. It really gets to that clinical high risk piece. We hired a parent partner who can also act as a clinical specialist. And our clinical specialist has recently received her ASW number and become a certified substance use counselor. So she is able to provide both therapy and substance use counseling, which are all components of the EIS program. The biggest challenges we have faced is pretty much what you've been hearing. We have major capacity issues. There are just simply more clients who are in need of services than we have staff to provide those services. And then as far as what's new and what's working, so we are currently working with the Access team and EpiCal Plus to streamline the EIS intake process. We are also working with EpiCal Plus to develop a plan to meet the training needs of the program staff.
Could you talk what Epi means?
So EpiCal Plus is that statewide initiative. It's that grant we just received. So pretty much we are partnering with UC Davis, Stanford, and SFSU, San Francisco State, I think. No, not San Francisco State, UCSF, my bad, in order to implement all these programs. So we're really using evidence-based practices. We're getting trained up on the evidence-based practices, and they're working with us to make sure, like, create the accountability measures, make sure we're meeting our accountability measures, just kind of develop the entire program to make sure it is reaching full fidelity within about 4 years. Does that answer the question?
Yes.
Awesome. Okay.
Thank you very much.
So EpiCal Plus is, those are the people we're working with, and they're helping us identify the training needs, develop outreach materials so we can increase our outreach within the community. Currently, we are about to start implementing standardized assessment for crisis for the youth in our program, youth and young adults. And we are also, working on tools that can track the changes in symptoms. So that's that accountability measure piece. And we're also, now that Susanna is a substance abuse counselor, we're working on developing a substance use support group for our clients who struggle with substance use, which is awesome. And so then modifications we've changed. Well, I haven't attended a stakeholder meeting before, but I can tell you in the last year, we've made a lot of progress. We attended a bunch of trainings over the summer from UC Davis just on how to begin to implement this program. We developed like a clear set of criteria for clients who are admitted into services on the EIS team. And we've been working on developing a collaborative relationship with the different peer support centers to help meet our clients' needs. We've also initiated the EIS assessment process. And as I said earlier, we got a parent partner on our team, which has been a huge help. So that's what I have.
Great, thank you. That parent partner was our parent partner for MHSA. So
I know we stole her.
Right, you stole her. But as you can tell by listening to Elizabeth right there, this is a really happening program at the moment. I was just thinking back as she was talking, it started off with this one clinician years ago, and now it's really grown, and it's really taken off, and it's although we still have capacity issues, we're doing a lot better, and the program is just really shaping up and forming well. Our next program I'd like to have discussed is our family stabilization and well-being, and that's our NEST program that Redwood Community Services does so well. And I was going to have Kim talk about that, but I don't see her. As Jolene, will you be filling in for Kim?
Kim is here. I believe she's she's in the harbor, so you can see her there now.
Oh, are you there? Okay, sorry.
I'm right here. Hi, everybody. Kim Guerra, Program Supervisor for the NEST. The NEST stands for Nurturing Education and Skills Training Program. We're a transitional housing-like program for families 18 to 25 years old with children who are currently at risk of experiencing homelessness or experiencing homelessness. We are under the umbrella of a housing first model. We also provide families with life skill support, parenting support, case management services, and in-house behavioral health services to those who meet that criteria. Our biggest successes that we'd like to note is that since 2013, we have served 55 mothers, 10 fathers, and 74 children. 10 of these families have come back from time to time, and that's usually because their housing might have become unstable during that time. And that's just for a variety of reasons. It could be a dissolution of relationship. It could be that the property they're living in sold, or whatever that case is. Some of our biggest challenges include that, we've been funded since 2013, but MHSA really stepped in just in the last couple of years. However, we're still working with the same furnishings and equipment that we purchased back in 2013. So we're looking forward to those expansion grant funds when they come available, to be able to purchase beds, just the normal furnishings that experience wear and tear, upgrade some of our play equipment and learning equipment for our youth. And then also, and I'm sure we hear this a lot and experience this a lot, housing inventory in Lake County is really limited. I believe I was in a meeting where at any time we could have anywhere between 0 and 8 rentals even available in Lake County. And often our NEST participants are usually at the bottom of that selection and prioritization list. That's usually because they don't have a lot of rental history. They don't have a lot of credit history. And so oftentimes that just makes them not as appealing to those particularly private homeowners who are trying to do their own private rental. So that can make it a little bit more challenging. Our most significant modifications that have been made really since the last meeting, and I can't even recall really the last stakeholders meeting, but similarly is managing COVID. When the pandemic began, it really impacted our ability to take in new participants. And it's been difficult as we've had, experiences where some of our participants might get COVID, and then that impacts whether people are interested or feel safe moving in, and how we're managing all that safety for our participants that are currently residing in that program. And as far as what's new and what we're working on, well, spring is coming and we are looking forward to starting our garden project. So they're clearing out the beds, starting to get some seedlings, and just trying to see what we can grow. And I think that's about it for the NEST, unless there's any questions.
That's great. I appreciate that, Kim. Kim, you does a fine job with the NEST. As you can tell by what Kim described, it's a really important program addressing some of the most vulnerable people in our community, mothers and with young children. And so I had an opportunity to go out there and visit that program, and was just really impressed with what they're doing there.
We're very blessed today to have a couple of our NEST participants joining us. So it was
great. Welcome.
Participate, so.
That's super. We can move on to our older adult outreach and prevention. And Rebecca, I'm going to go back to you again. But you're on mute.
Can you hear me?
Yes.
Okay, great. The Friendly Visitors Program is the other half of Canocti Senior Support. The Senior Peer Counseling Program is what Francois supervises, and that is seniors counseling seniors under the training and supervision of a licensed therapist. Our half is directed by me. It's called the Friendly Visitors Program. Adults of any age, volunteers, connect 1 hour a week for companionship with older people who are housebound and isolated. And we're actually pretty much a success, even though our numbers are small. Because of COVID, when I started working here in July, we had only 3 volunteers and 5 clients. But now we have 10 volunteers and 10 clients. I feel really good about that. The biggest challenge, of course, is that people are afraid to make home visits or receive home visits during the time of COVID. So we have expanded, and now we do some phone visits. The other challenge that we have is that so many of the isolated older people actually need enormous amounts of case management and resources, which we're not empowered to provide. We're just providing heart-to-heart communication, companionship, 1 hour a week, that kind of thing. So I'm really happy to know that there is one person doing outreach and case management to senior centers, or at least that's planned. So maybe we'll be able to connect with that person in the future.
Yep, definitely.
Yeah, and we are always in the transition of needing more staff. Our Francois is going to be leaving us in March, which is a big loss. So we need a therapist to work with our senior peer counseling program. And otherwise, I think we're doing really well. Thank you.
Thank you, Rebecca. And again, it's really good to see you.
Thank you.
Okay. Next we have, what is it? I have our peer support recovery centers. Carrie, could you start that off there?
Sorry, Scott, I'm trying to rectify the little issue that we're having right now. So, so I am, did you want me to report out on the peer support centers right now?
Yes.
Okay.
Just do an overview first, if you could, and just.
I will. Our peer support centers, including the harbor, are there to serve our community where the people live. We have the Big Oak Center, which is over in Clear Lake Oaks. And we have the Family Support Center, which is in Middletown. We have, and let me backtrack. The Big Oak Center focuses on our homeless population and severely mentally ill populations. And the Family Support Center is where our parent partner will be housed or is housed. And the parent partner is there to support our parents that have children that are either in the behavioral health system or that, they're trying to get services for their child, whether it's a youth or an adult child. So then we have La Voz de Esperanza, which is in Clear Lake. I love seeing everybody that's down there. And their focus is our Spanish-speaking population. And then we have the Circle of Native Minds, which is in Lakeport. And love seeing them too. Hi, guys. Their focus is on our Native American community and, bringing the culture back into the community and starting that healing process. So all of our centers are now access points for HMIS or CMS? CMS.
Well, HMIS.
HMIS. And which allows us to submit applications for the emergency housing vouchers that we have had this year. Yay. some of the challenges that go through all of our centers has been COVID, because peer support is an in-person type of support. You know, it's the beginning of that continuum of care, and it's been a challenge to reach people virtually. But when we do have people come into the center, we follow all the COVID protocols. Staffing has also been kind of a challenge, as well as engaging community stakeholders. So I believe that Davy and Edgar and Thomas all, well, I'm gonna report out for Lavos, but Davy, did you want to talk about the Big Oak Center? Are you still here?
Yeah, I'm here.
Okay. Hi.
So yeah, I'll go on ahead and start with, I got the questions right here. So one of the biggest successes we've had over the last, I guess, year would be we've gone to extended days of operation for one. As much as we can, we're open on the weekends where we previously hadn't been. Other successes include we've worked with all of our community partners very well. Every Tuesday, we have what's known as the pop-up shower program, where a shower comes in. That's our community partners at Adventist. They bring a shower trailer in for the homeless to get showers. We do a hot meal with soup and a sack lunch for the people that come in. We typically have Catholic Charities doing Medi-Cal and food stamp applications here. And recently we've added the free phone people here in the parking lot. So you can basically come in here, get a fresh set of clothes, hot shower, get your Medi-Cal and food stamp set up, get a hot lunch, and maybe a free phone if they make it on that appointment. So we've been very successful with that program, and we typically are serving 20 to 25 people every Tuesday with that, and it keeps expanding. So I'm really excited to report on that. Our biggest challenges have been dealing with, of course, the dreaded COVID. We've had to modify a lot of the way we operate due to the mask mandates, closing, opening, all this, that, and the other, back and forth, and staffing to accomplish our stuff of staying open 7 days a week. So that's been the biggest challenges we've encountered. So what's new? Well, what's new is we recently acquired a outreach van to do outreach with. So in the near future, I'm going to be going out on Thursday and doing outreach into all the homeless camps. By the way, Big Oak here primarily serves the homeless, the severely mentally ill, and the homeless, severely mentally ill, and the addicted populations. So we're going to be going out in this van every Thursday once we get it completed. It's being wrapped right now as we speak, getting everything done, outfitted and whatnot, so we can get that out there every Thursday. So that's going to be, I'm excited for that. That's going to be something new that we're working on right now. Also working on getting public health in here to do vaccinations and testing. That should be coming up in the near future. There's just a few I's to dot and a few T's to cross left on that project. So they should be coming in probably within the next month to do some COVID testing, as well as the vaccines. I know the vaccines for sure. I'm not sure about the testing part. As far as modifications and changes we've made since the last meeting, well, I think I just explained pretty much all that. So we're continually expanding what we do. We're continually adding to the program. We're going to have some exciting groups coming up this in the near future. Life skills, survival cooking, maybe some art groups, and Friday movies and stuff going on. So yeah, we're a busy bunch over here at the Big Oak, and we're constantly, like I said, trying to expand what we already do. So
all right, thank you, Davey.
The other thing is we've really expanded on our Facebook digital media page too. We're now up to nearing 400 members on that. So that's been working out pretty well too. So that's about all I have.
Awesome. I know we're super busy over there. Thank you. I appreciate the report. We've got Family Support Center. Tony, who is our client support assistant, sent me an update. She said that the biggest successes have been providing a safe space for community members in need, helping to get unhoused community members housed through the emergency housing voucher program, providing struggling families with access to clothing, diapers, food, and toys, and allowing the community members to not only get help from us, but to also help each other through our Facebook page. Challenges, location is a challenge. People have a really hard time finding the center. Reluctance. People are often wary of asking, receiving help, or utilizing the resources there due to stigma in that area of our county, and staff shortages. And they now have monthly food giveaway. They have what's called the community advice or positive words board, which allows community members to post up resources and positive affirmations. The emergency housing program, our Facebook page has 500 plus followers, and keeps everybody informed during the COVID restrictions. And that's actually where we had our parent cafe up and running. What we're trying to do is to get the Adventist Health pop-up care trailer there, working with the schools in order to bring in the students and parents, the mobile outreach team, getting more groups started at the center, and, you know, just getting the word out that we're there. And we're also working with the Native community population on the south end of the county to engage their, you know, that population. So we do have some really big changes with Lavos. We actually moved, I believe, since the last meeting, maybe. And we are now located on Lake Shore in the city of Clear Lake. And we've got the same groups going on there. And I think that one of the challenges, you know, was we had to close down for a couple of months, but as you can see, our community has started utilizing the center again. They have the clothing closet. They have a food giveaway there monthly, and as well as, you know, like school supplies, backpacks, that type of stuff, emergency backpacks. So, and then also the Circle of Native Minds has moved, and we are open again. Yay. It felt like forever that we were closed. I know that Thomas has cultural activities going on out in the community, as well as helping out our unhoused population. They are able to go in there and get help with paperwork, applying for the emergency housing vouchers, and have a meal. You know, I think that's one of the biggest supports that we provide at all of our centers is we have food there for anybody that's hungry. So challenges have been the move, and, you know, now just getting the word out that we're open. There will be a reopening ceremony sometime in March that invitations will be going out for. So I know that was longer than 3 minutes, but that was a lot.
Okay, great. Thanks, Carrie.
You're welcome.
Next, we have our postpartum depression and screening, which is our Motherwise program. I didn't see Liz, but it looks like Veronica, are you going to be reporting?
Scott, I'm sorry to interrupt, but was the Harbor going to have an opportunity to share?
Yeah, let's do that. I'm sorry. Let's do that.
Thank you.
Sorry, Jolene. I thought that Kim had already gone. So, Kim, it's your turn.
I thought that was for the nest. I'm sorry, I missed.
Sorry, before we get there, it looks like Raven had her hand raised at the hub. Yeah, go ahead.
Raven is actually me. We're the Harbor Youth Resource Center over here. And thank you, Jolene. I was trying to raise my hand too and get in. And yeah, I did report, but just for the nest earlier. So thank you. So as was likely mentioned, and forgive us, our internet stable or our internet connection is unstable right now. So we apologize if we break up. But the Harbor is a youth resource center. It's a transition for transition age youth, 16 to 25. We provide a variety of different services and supports, including access to other programs. So we can provide referrals. We provide resources to meet acute needs. So that could be clothing, hygiene, food, transportation passes, things of that nature. And we want to appreciate one of our Harbor Youth Board members, or a couple of our Harbor Youth Board members, for also joining us today at this meeting. Some of the biggest successes that our program has accomplished is that we've reestablished and we are currently maintaining our Harbor Youth Advisory Board. And one of the subcommittees of that youth board has been developed in partnership with Hope Rising and through the All Children Thrive grant. And so we have a subcommittee of our youth board, which is focusing on policy change within the community of Lakeport. We've had a great participation from students and members in regard to that program as well. We recently partnered with Sutter to develop and implement a peer mentoring training program in which we had six peer mentors successfully trained. And we have also revamped and restarted our LGBTQ2S+ support group, which we've had some more interest in participation in that as well. And most notably in 2021, we provided 3,795 services, had 894 visits, and served 194 individuals. And then some of our biggest challenges, I mean, I'm just going to mirror the COVID. It's been really difficult. You know, we often want to get into the schools, and many of our students are going back and forth between online schooling or distance learning, and then getting back on campus. And so that's been definitely a challenge. And then trying to, remind students we are here and we're still holding groups both in person and virtual. And I think, we're really trying to strive to do more outreach with our older youth, so our 22+ age group. And we've also had some difficulty managing how we're able to still support our community members, particularly those experiencing homelessness, but who are outside of our target demographic. It's really been difficult with staffing. The Harbor has been functioning with one full-time staff, Raven, who is our peer support counselor and has really been holding down the fort. But it's really difficult, as we mentioned, we are part of the emergency housing voucher access point, and that requires a lot of time and effort on our peer support counselors' plate. And then in addition to running all the other groups and services too. And so staffing has been difficult, and really also trying to maintain equity within our center in regards to the other peer support centers. So really trying to be, be on the same wavelength as far as technology resources, transportation resources, staffing resources, and things like that. We are the only contracted peer support center. So we are under the umbrella of Lake County Behavioral Health, but we are actually, we are a division of Redwood Community Services. And so it's just trying to find ways that we can still be associated and partnering with the other peer support centers. And so like the Smart Board, for example, we had to apply for a mini grant in order to get, be on that same length with the other peer support centers as well. So that's been a little bit challenging, but really our biggest, I think, is just maintaining safety within the resource center and trying to continue to support our other community members outside of that target age range, especially with one staff. So that seems to be our biggest challenge. And then what's new? We've had a lot of new things happen. As I mentioned, the All Children Thrive grant, we've partnered with Hope Rising, and we're helping facilitate that Youth Governance Council. We have also recently began, we received a grant for Elevate Youth California, which is a youth substance use prevention program. And so we're in the planning stages of that. And we're really excited as we've had a great response from community partners and tribal organizations. And we will really be focusing on supporting or reducing youth substance use in our Native American and Latinx communities. And we've had more frequent LGBTQ+, LGBTQ2S+ meetings, and as well as, providing more services and resources for our trans and our non-binary youth. And then modifications, changes. I think we're just really adjusting with the, with the rest of the community and society as far as COVID and things like that. So lots of exciting stuff on our horizon.
Great. Thanks, Kim. I appreciate that. I really appreciate the work that the centers are doing. I think that's one of the highlights of our MHSA program is our centers, especially in kind of relation to the rest of the state. Although we are a small rural community, having these 5 centers around the community that are each kind of, target specific populations, especially those populations that are traditionally underserved, I think is really extraordinary. Anyway, I do want to go now forward to Motherwise, as I promised. And Veronica, are you going to be representing them?
Hi, yes. My name is Veronica Pantaleon, and I'm the bilingual concierge. Liz couldn't be here today. She had to take her daughter to UCSF, but she prepared a statement for me to read to everybody. So as an MHSA service provider, Motherwise works directly with the community to support individuals at risk of experiencing a maternal mental health complication. Research shows that up to 1 in 5 moms will face a mental health challenge in pregnancy and postpartum, and it is believed that this rate is higher in Lake County. Motherwise's screening services help identify at-risk individuals, and the support offered through our program activities often make a difference in moms speaking up and seeking help early on. While Motherwise has been doing this work with moms and families in our community for over 12 years, we are fairly new as a 501c3 nonprofit organization. This status is one of the biggest successes, as we can now apply for grants and accept charitable donations to expand our services in the community. With an evident need for Motherwise in Lake County, additional funding is necessary for our program, and we are proud of the steps we have taken to sustain our growth. We were recently awarded a grant from the Lake County Wine Alliance to improve our mom-to-mom closet and the concrete support we offer to local perinatal moms and families in times of need. We have received these funds and are currently using them to buy needed equipment and hire additional part-time team member to staff our closet specifically in order to improve the time it takes us to get needed items to the families. Providing MHSA services has been a challenge during the pandemic. Even so, Motherwise has been able to successfully reach the community and make a difference in the lives of moms and families by focusing on connecting with as many pregnant and postpartum individuals as possible. During the first half of the fiscal year, our small staff closely worked with over 350 pregnant and new moms. There are between 600 and 700 births in Lake County each year, and we want to reach every mom. Imagine how this reach could grow with additional MHSA dollars. The single biggest challenge Motherwise has encountered this year is staffing. The pandemic has made it difficult to not only recruit the necessary number of staff and volunteers needed to operate the program as well as we would like, but simply keeping a physical office running with such a limited number of team members is also challenging. Potential and certain COVID exposures may continue to make providing services difficult, but we are focused on offering the highest standard of support to local perinatal moms and families and are working on filling 2 open staffing positions. Our Village Facebook group has welcomed 256 new members in the first half of the fiscal year, all of whom are Lake County moms. Of these new members, 132 are perinatal. Social media and remote support have made it possible to connect with and serve these local mamas, and additional planning from our end seeks to improve upon current program operations in order to better meet the needs of these community members. At the moment, Motherwise is working on quality improvement with the goal of increased screenings and in-person services. We continue to offer most of our program activities and are planning to adapt and reinstate services that we were put on pause due to the pandemic. It is our mission to make sure that every local expecting a new mom knows that if they feel depressed, they are not alone and there are effective resources available to support them. We know that the maternal mental health complications are highly treatable with adequate support, and that prevention and early intervention do work. This is why Motherwise is an essential MHSA partner and why our staff is so passionate about the work we do. Lastly, I'd like to share 2 testimonials Mom sent us recently. Motherwise is amazing. I had twins back in November. Motherwise and the other moms in the group pulled together and helped me get more than enough for my twin girls before they were even born. Veronica gave me a twin seat, which is so awesome and convenient. My twins came early due to one of them having a severe brain injury due to COVID. When I told Veronica about this, she offered me support right away. When I commented my daughter's story on a post about a pregnant mom with COVID, Veronica and Liz both reached out to me again. Liz called me offering her support, and she even helped me with special resources for my daughter. It has been a long, hard road for my family, and I am so grateful for the Motherwise group. If it weren't for them, my girls wouldn't have what they need, and I have been able to pay it forward a little here and there in the mom group on Facebook, and that also helps my mind right now. This was from a 30-year-old, third-time mom of 4 from Clear Lake. The next one is, I want to share my feelings and thoughts on the Motherwise organization. I have been in close contact with the team at Motherwise since about August. I have postpartum depression. I have had a pretty rough time until I met them, that is. They go above and beyond what any other single person or organization I have been in contact with has ever done for me and my children. Just to start, whenever I needed something for either of my babies, they helped out with what they had on hand, and they even triple checked around to find things I needed. There have been countless phone calls and texts just checking up on how I am doing and how the kids are doing and if we need anything. There have been more than a few times that they talked things through me when I had no one to talk to and felt mentally broken down. I know that the team is always a safe place to talk to about my mental health problems without judgment. They always help with connecting me to the right community resources. I don't know what I would have done if not for the comfort and help these beautiful inside and out ladies. I have cried and I just know they shared my pain and helped me find solutions. Thank you. We love Motherwise. This was from a 38-year-old second-time mom of 2, homeless and safely housed with family in Lakeport. Thank you.
Thank you, Veronica. As you can see, Motherwise is a very, very significant program that we have. We're very, I think, fortunate to have a program like this in our community to address the needs that are present. That was a great example, I think, of the service that can be provided. We're running short on time, so I need to keep moving forward. I'm going to turn the time over to Carrie to talk about our next few items that she's actually over all of them, which is our mental health first aid, which became its own program this past year. We have the prevention mini grants, which we've had for quite some time. Our state, regional, and local projects, which are mostly our stigma reduction projects, and as well as I'd like Carrie if you could talk about our suicide prevention within that too, and then also the street outreach programs, which is also a new program. Davey started talking about it previously with the outreach van. It will employ our new prevention outreach staff that I've mentioned previously that will be one that will be working with our seniors, but also we'll have an outreach worker assigned to doing using the van, taking turns with the van and doing outreach that way. Anyway, let me turn the time over to Carrie.
Hello again, and I didn't introduce myself properly earlier. Carrie Manning. I am the basically the team lead for the Mental Health Services Act team, and I supervise these programs as well as the peer support centers. So Kendra sent me an update, and I am going to give her update on these programs. So mental health first aid is a course that teaches you how to identify, understand, and respond to signs of mental illness and substance use disorders. Adult classes will be offered in late April. Information on how to register will be available in March. Youth classes have been offered to staff at Upper Lake High School, and more classes will be available in the summer months. Information on how to register will be available in May. And if your organization would like either the adult or the youth, the adult mental health first aid is for people that mainly work with adults. And the youth mental health first aid is for people who work with our youth. And they're valuable trainings to go to. If your agency would like to have either of those, we do offer those. Just contact myself or Kendra. I will put both of our emails in the chat. And then we also have our teen mental health first aid, which is actually for our youth, for our students, 10th, 11th, and 12th grade students. And we have completed, I believe that we completed a group of youth at Canocti Education Center. Today we are at Clear Lake High School doing a question, persuade, and refer training. We're very active out in the schools, but the teen classes have been completed at Canocti Education Center, Upper Lake High School for the 12th grade students, and we are finalizing plans for Clear Lake High School. So mental health first aid is a really great program, and our youth are learning how to support each other through these challenging times. And our goal is to eventually get all of the schools on board to do annual trainings with their 10th and 12th graders. And, you know, we're hoping that this has a ripple effect out in the community. So that's our mental health first aid program. And our prevention mini grants, I'm just going to give a really quick update. We did award 11 grants this year. We all the way from like food and mental wellness, Cool Kids Solar Workshop, Robinson's Elders, overdose awareness, education and prevention, healing through writing, and comprehensive celebration of life and loss skills workshop with hospice. The Yamabax Wellness Circle, I'm sorry if I did not say that right. That's with the Scotts Valley Band of Pomo Indians. Breaking Through Isolation, Wings of Hope, one-day bereavement camp, and a mini camp, and then also for the Harbor Youth Advisory Council. And challenges for both of those have been because of COVID and all of the restrictions, and also scheduling and staff. Right now, currently, we have 2 prevention specialists that are in all of our schools and reaching out in the community. And we do have 3 open positions that should be posted soon. So if anyone on here knows of anyone that might be interested in joining our amazing mental health services prevention team, have them look on the county website. So
I also just want to mention real quick that our MHSA prevention also works hand in hand with our SUDS prevention too, who have their staff, and so who are also going into the schools. So this is a really good blend of both mental health and substance abuse interventions working together.
Yeah, and we also work with our SUDS prevention, and we're also involved with the SafeRx program, because I mean, substance use and mental health, they're hand in hand, and a lot of our suicides are because of overdoses. And so yeah, we definitely work and collaborate with numerous agencies. So do you want me to move on statewide and regional projects? These are our stigma reduction projects and programs. So we have QPR, question, persuade, refer. The vision of that program is to reduce suicidal behaviors and save lives by providing practical and proven suicide prevention trainings. We've completed those trainings at Upper Lake High School, Middletown High School, and Clear Lake High School. And we are working on the other schools in our community. And we are also offering QPR classes to LCBHS staff and in March, and community classes will be offered during the summer months. And And Know the Signs is another one of the programs that we're using. It's an age-appropriate suicide prevention awareness talk, and that class introduces students to an awareness of warning signs of self-harm and suicidal thoughts and behaviors. Know the Signs classes have been offered at Lucerne Elementary School to the 7th and 8th grade students, and we're also working with other schools to have them on board. And we've also started self-care kind of life skills class at Lucerne Elementary, because they reached out with concerns for the students and lack of therapists and support for their kids. So Kendra was able to come up with a little program to go into the schools weekly with that, and she talks about journaling and self-care. So and challenges have been COVID and scheduling. We also, as part of our stigma reduction, have an event coming up on May 14th, and that is going to be held at Library Park here in Lakeport. And it is from 10 to 2. We're going to have numerous people from other agencies that are going to be there. And that is Mental Health Matters Day, May 14th, 10 to 2. So, all right. So the street outreach, did you have anything you wanted to add to the statewide?
No, other than they have a new program. They're going from Each Mind Matters to Take Action.
Take Action for Mental Health is the new campaign that we're going to be utilizing. But because it's so new, we're still, this event is still Mental Health Matters Day. So / Take Action for Mental Health. But you will start seeing some of that literature around the county. So our outreach program, like I said before, we do still have 3 prevention specialist positions open. They will also be working the outreach. And the outreach van will be going around to all of the different sites in the community. We're working with the Lake County Continuum of Care to be able to have other agencies that want to collaborate to come out with us. There will be at least 2 people in the van. We plan on it being out and about 5 days a week, and we will have iPads on board as well as a cell phone. So if we run into people that need to, like call their doctor for an appointment, they can. If they need to meet with probation, they can do that on the iPad. We also have access to the Bright Heart telehealth system. And so people will be able to access the telehealth services from the van. And they do mental health counseling, substance use disorder treatment services. They do medically assisted treatment, the MAT program, and they also work with eating disorders. And so super excited about that opportunity on the van. We'll also have like personal hygiene items like tarps, bungee cord, stuff that people will need out when they're unhoused. So, and hopefully it will be, the challenges have been getting it upfitted with storage and shelving. So that has been a huge challenge, but we're getting through it.
Okay, thank you.
Thank you.
Okay, as you can see, those are both community support services and supports and prevention and early intervention. Those are our 2 major programs that we have. We're also running super short in time, so I can only just briefly describe the last 3. Innovation, which is 5% of our services. We have an ongoing project, well, a project that just started this past year, it's a multi-county collaborative, improving our FSP services, particularly through data. And so we are meeting with a consultant who is working with all the counties that are involved to do that. So that's an exciting prospect of improving services. Cap facility tech needs, we haven't done a lot with that at all, just because we just haven't had the opportunity. We still have in our plans to upgrade our Clear Lake clinic. And so we have funds that are in reserve for that. We also in the process of getting a new electronic health record. Our current health record is going to be sunsetting within the next year or so. And so we're working with also multi-counties to find the best electronic health record that we'll be adapting, and MHSA will help fund that. Last, workforce education and training. This addresses, as you heard mentioned by multiple of our programs, especially our internal programs, that staffing is always an issue. So this workforce education and training is an attempt to help address that by offering workforce education and training. In this case, we're working with also a multi-county collaborative, the Superior region, Northern California, small counties, in putting our funds together, having some matching funds by OSHA from the state. And from that, we'll be able to do loan repayment, stipends, and a few other little efforts like that to try and retain staff, to recruit and retain staff. Okay, that's all. I ran through as quick as I can. I apologize to RDA who's staring at me intently. So let me turn the time back over to Aditi.
Great, thank you so much, Scott, and thank you everyone for the great report out. We really appreciate all of the inputs. So we obviously have gone a little ahead of our slated time. We were going to have a 10-minute break. I just want to ask folks, we have approximately about 20 minutes more of our time with you, and this includes the breakout discussions. Would folks like to just get maybe a 2-3 minute break so that they'd like to stretch and move, take a bio break, and then we can come back and reconvene? We were going to have 20-minute breakout discussions, but I think they're going to have to be condensed to about 10 minutes. So let's do this. So right now on my clock, I see it's 11:37. Maybe we take a couple of minutes and come back at 11:40. Would that be okay with everyone? And we'll see you in a minute. Thank you so much. All right. It looks like it's 11:40 on my clock. Want to give folks just a little time. Sorry, I know that was a lot of information. We apologize. It was very important information. So I'm really glad the programs had an opportunity to report out, and we really learned so much. So for the next half of the session, this is really dedicated to the needs assessment piece. I'm just going to move us along. And this is really where we're going to have the stakeholders break out into different groups for the discussions. And also to let you know, and this is specifically for the center facilitators, that you can sort of continue to unmute yourselves on Zoom, and you can have these discussions in person with all of the community members who are present. We were going to have this for about 20 minutes, but I think given the time that we have, this is going to be approximately 10 minutes, so we can all return by 11:50, because we did want to reconvene. We had some more updates to give you all before we all sign off at 12. So let me, so just to let you know, these are the two stakeholder questions that we're going to pose to everyone in the breakout discussions. This is for both folks who are joining us virtually as well as for the centers. The first one, as you can see here, is based on what you just heard from the program. What are some gaps folks feel still exist in the services that are being provided? And then secondly, what can be done within existing MHSA programs to better meet the community's needs in the upcoming year? So as you can see, these are really open, broad questions, and we would really love to invite everyone's thoughts and perspectives on this. So what I'm going to do right now is actually set up our Zoom breakout sessions. Let me go ahead and do that. There are going to be 3 sessions for the virtual groups. And then, of course, like I said, the centers have their in-person sessions separately. Right after the 10 minutes, Zoom has this feature of snatching everybody back to the main room, where we will have an opportunity to reconvene. And I might call on one center as well as have one of our facilitators just do a very quick report out before Scott and I tell you about what to look out for in the immediate next steps. So let me just go ahead and modify my time on the breakout groups, and then I'm going to open up all the groups. Oh, sorry, go ahead, Scott.
Aditi, as you're doing that,
yeah,
so you can focus on that. I just want to say, so these breakout groups, there's a facilitator for each one, and they'll be gathering information from these questions and transcribing that down, and so that will be used. So if you don't get a talk, in the last 10 minutes, it's okay, because we're re-recording what the discussions are saying. So that, because we, like as I mentioned before, the idea of this particular meeting is it's data gathering. The first part of it was informing where we're at, and so you heard that, and now we're trying to hear the answers to these questions based on what you know now. What else can be done?
Great, thanks, Scott. All right, I'm going to go ahead and open up the rooms, and then you should all receive a prompt. Oh, did folks get? Hang on.
Everyone understands how to join a room?
Yep. You should get a prompt and then just accept that, and then it should take you directly to the room. I'm just manually assigning some rooms because it looks like everyone's not automatically getting assigned.
Okay.
I'm not quite sure why, but okay, let's see. All right. Oh, okay.
Okay. So everyone's assigned?
Not yet, Scott. Okay, yeah, I think, yep, it looks like they have been.
Okay. Good.
Which I just want to make sure which one okay, I think I can join. All right. All right, thank you. Okay, we're still waiting for other folks to come back to the main room. Just give them a few seconds. And again, we're very sorry that was too quick to receive inputs. And like I said, there will be other opportunities for folks to weigh in, as we would really like to learn from you. So, all right, looks like folks are joining us back in. Do we have everyone here? Nimisha, Jamie?
I think you might need to Zoom snatch some people.
Oh, did I? Okay, do I need to? Well, I just kind of did. Oh. Well, it's gonna close, and unfortunately it's already set on the time, Anusha. I don't think we can do much. So we'll just wait for folks to chime in. But for those of us who are here, and I'm also wondering, it looks like, do we have any of the center folks on the Zoom call?
Yeah, they were put in other chat rooms though.
Okay, yeah, I definitely assigned them to different chat rooms. I'm just wondering if we'd like to just take a brief moment and maybe just hear from one of the centers. We're just curious
I'd like to hear from LaVos. Looks like there are a lot of people at LaVos.
Okay, great. So can we have the facilitator,
It's
LaVos?
Edgar was I think they're logged under him.
Great. So do I see Edgar? I don't see him on the screen. So while we're waiting, Nimisha, I was hoping Jamie would do this, but I was wondering, I might put you on the spot and see if you can just give us a quick report out of what you heard from your group, just for both the questions that were posed. So go ahead.
Sure. Yeah. So the providers in my group spoke about just a lack of staff and mental health professionals that are serving the community. I feel like that was also really reflected in the status update beforehand. And in speaking about what can be done to improve and create more accessibility for the community, I think that we were talking mostly about housing and creating a sort of like long-term shelter that's also like outside of that, also creating like low-income housing because of the lack of housing inventory, because of the fires. There's a lot of housing, but it's mostly quite expensive and for higher rent. And during the last parts of the discussion, we also talked about kind of like the abstract ideas of housing that's kind of like swirling in the federal and state like legislation for Lake County, and wondering how to concretize that into like funds and how to create action from that.
Great. Thank you so much, Nimisha. Really appreciate that. Again, I just want to invite the opportunity to have maybe one of the centers weigh in. Scott had requested Edgar from LaVos. Edgar, do we have you on the call?
I don't see him. We might have lost him. Oh,
yeah,
under Laura. Edgar, I see you. Can you talk about what you guys are talking about?
Oh, is that you using Laura? So I'm gonna have to. Sorry, we can't hear you, Edgar. There we go.
Can you hear me?
Yes,
yes, now we can.
Yeah, so basically, I was talking to the community about the importance of Prop 63 in our mental health services. And the community is very impressed, about the services we're providing. They're willing to keep participating in the future. It was a little bit difficult for me to hear the entire meeting. I was trying to translate as much as I could. But seems to me like the community is very happy to know that we have programs like FSP, programs like prevention, and they want to keep participating. We had a big number of community members today here at LaVos, and we want to hopefully in the future to increase those numbers. I think we were more than 23 people today,
Yes,
Laura.
27 altogether.
27 including clients. And, I'm very happy for the community participation. and very happy too that we are able to attend the meetings via Zoom.
Excellent. Thank you so much, Edgar.
And Edgar, one of the focus groups that we'll be doing within the next month will be with BOS.
Yes, absolutely. I was just going to say that. So in fact, in the last minute or so that we have, and again, we apologize, we sort of sped through the last section, but I'm just going to quickly walk over what to sort of be on the lookout for. These are just the immediate next steps. And as you can see right here on this screen, we are going to be launching into focus groups in March. And these are going to be focused primarily at the centers where we really want to capture family and consumer voice. And that's really key. And we want to sort of bring that and elevate that. Outside of that, we have our second community forum. And as Scott mentioned, that's going to be an opportunity for folks to, again, weigh in and potentially strategize about what updates can happen to the programs that we just heard about. We will then also develop the annual update, post for public comment in May, and have a public hearing in June. I know those are quick, immediate next steps.
Can we put the, I was going to say, the survey, not only the survey, but not only the survey for this, but also the feedback survey. If you feel like you didn't get a chance to talk today, or if you would like to add more, we have our regular survey. If we could put that in the chat, where you can go on and do it's a Survey Monkey, and just do add in your comments.
Perfect. Yes, absolutely. So I know there have been opportunities, and we will be following up via email. So Nimisha, if you could drop, I think Scott's talking about the stakeholder survey. And in addition, we also would like to invite you to participate in our feedback survey. Folks who are there in person, you should have received a feedback form. And so we would really love to hear just your thoughts about how this whole session went. And as I just mentioned previously, there will be additional opportunities for folks to chime in. So be on the lookout for that. We're definitely in the midst of planning for that. All right, and Scott, over to you. This is really our thank you slide.
Right. So here we are right at noon. So we're going to let you go. Again, thank you so much for your attendance. Again, your participation is paramount. And we do this to serve our community. These are public funds that we're using. And so your input is extremely important in this process. And we take everything that you say seriously and try and incorporate it into our plans as much as financially and logistically possible. Thank you.
Perfect. Thank you so much. And again, just to reiterate, we are so thankful for your time, and like I said, there will be additional opportunities for folks to weigh in. So be on the lookout. And as you can see here, we are going to provide the recording as well as the slide deck, and it's going to be on this website. Nimisha's going to also drop that into the chat so that folks know. And then just look out, Patty's going to be sending a follow-up email to everyone. So thank you all so much, and have a great rest of your day. Thank you.
Bye, everyone. Scott, did you want me to stick around?
Yeah.
Or are we done? Okay.